introduce myself, and then we can go ahead and popcorn style. So I'm Katie Amy. Everyone's probably already heard from me. I'm with Children's Mercy as well, but I work for the Kansas City Healthy Lifestyles Collaborative, and I support a lot of our different initiatives, one being the KCPA plan, and I support the healthcare sector, which is this sector. On that note, I will go ahead and pass it to Dan. You're on my
Hey, good
screen.
afternoon. I'm Dan Kane. I'm exercise advocate, and I've had many years in healthcare on the insurance side with the insurance companies Blue, Coventry, blah, blah, blah. And I'm glad to be here.
Catherine, do you want to go next?
Sure. I've been here before, but not for a while. I'm Dr. Miner. I teach in a really small capacity for UMKC School of Medicine, both medical students and PA students in lifestyle medicine, and I teach culinary medicine in the multiple community groups as well, focusing on transitional housing participants. But I'm here because lifestyle medicine incorporates not only diet, but a lot of physical activity, coaching and education, and trying to promote that not only in the community, but in the healthcare sector and healthcare professional students as well. And I'm going to choose Amanda.
Hi there. My name's Amanda. I work at St. Luke's Health System. I really work and focus on our community benefits side of things. So just looking at what are we doing outside of the walls of our hospital. So happy to be here. And then I will choose, let's see, Helena, or did you just go?
Nope, I didn't.
Okay.
I'm Helena LaRush. I am over at Children's in the Center for Healthy Lifestyles and Nutrition. I am a child weight management physician, but my research interests are obesity prevention and treatment and connection to social determinants of health.
Does that leave just me, I think?
Yeah.
Hi guys, I'm Nicole from Eric. I am a physician. So I trained in Kansas City at KCU, and I'm now back on faculty. I'm a family medicine, osteopathic neuromusculoskeletal medicine, and sports medicine physician. So I work at KCU, and then I also see patients over at Sano Orthopedic or Specialty Care in Overland Park, doing non-operative musculoskeletal diagnostic ultrasound, all of those kind of things. And then my colleague who's not here, who you may see at times as well, is Dr. Diane Elledge. She is also a KCU alumni and is family medicine and obesity medicine boarded. When we both kind of came on, and in the last 6 months or so, KCU decided, I know KCU representatives used to come, I believe, to this meeting, and things got busy. And so we are a part of the initiative of the medical schools that are adding the 40 hours of nutrition curriculum. And so Dr. Elledge and I are two of the representatives for that. And so we wanted to kind of reach back out and get some connections and be able to help in the community or find ways for our students to get involved or whatnot. So we are just here to absorb and help and be as collaborative as possible when we can.
Awesome. Well, thank you all for joining us. Yeah, so you're over at Sano. So you work with Michael Schwarzer quite a bit there?
I do every day. I was just messaging him this morning.
He used to be my clinic athletic trainer. So
oh, awesome. I love Michael. Yes, he's wonderful. So that's why I was saying since I'm sports, I'm always looking for myself and for our students and our fellows to get involved. So I'll have to reach out to you at some point so we can chat about that if you're ever looking for extra hands.
I think we're going to start off with just a little recap of the last meeting. Katie, do you want to do that part since you've got the paper in front of you?
No worries. This will be pretty brief. So at our last meeting, we did kind of discuss the direction of the entire sector and where we were going with it, such as shifting to bi-monthly meetings. We also discussed perhaps reevaluating our strategies at some point, and if anybody would be interested in forming a small team to review those strategies. And then we just gave some updates on some of our subgroups, such as our curriculum and our billing and reimbursement group, as our billing and reimbursement was our biggest news because we were restarting that subsector group after, I don't know. I know it's been on hiatus since I've been with the KC PA plan, so that's been 4 years. We also discussed recruitment strategies and who we should be reaching out to invite to this sector, such as like physical therapists, public health specialists, pharmacy students, or other residency programs. And then I believe that was it. That was the gist of our last overall healthcare sector meeting. If you're interested in reading or reviewing all of that past meeting, I can direct everybody over to the video recording, and it's also in our notes, which I can either send via email or drop in the chat. So, on that note, Jay, do we just want to jump into the rest?
Yeah, let's. We want to start with sector updates. I guess probably billing and reimbursement. The first meeting would be the most interesting thing. If Dan, you got any thoughts on it? Dan or Katie, whoever wants to chat about that, maybe.
Dan?
Yeah, I can jump in a little bit. Yeah, we discussed a couple different things on our sector meeting. I know Dr. Voren and a group of us, or 3 or 4 on, identifying kind of back to the coding, the remote, and I'll say the wrong, RPM, remote physical, remote monitoring. There were some issues with that. We talked a little bit about technologies and some of the data for wearables, and the use of that data and the integration of the information into the records, medical records, to make sure all T's are crossed for that. And then also a little bit about some goals to invite other areas of the healthcare, maybe some policy people that know, we're looking for, as we drill down, we'll look for resolution for some of these billing and guidelines, and also, opening up new reimbursement and new areas to coverage and guidelines and things like that. So that was kind of on the policy. Maybe somebody from the state, possibly, that's in the Kansas Health Institute's always a good resource. And then there's also the tech side of things. And there are some organizations on both sides of the state line that have kind of specialized in that area for identifying products, software that they've tested, that might be beneficial to our needs. Did you hear me?
Yeah. So, so happy to get that back started, and I'm glad you guys got some things to get moving on with that. It's been, it's a big piece of it. If we can't get people reimbursed, they might not spend time talking about it. So,
absolutely.
Thanks, Dan, for giving that update.
And then your next meeting is, are you going to do it every other month? Is that the plan?
We are still discussing that as we're still forming our small group. we would like to host our next meeting in person. We're still gathering everybody's schedule at this time. And if you're interested in joining the group, there is a link in the chat to the Outlook group team. This way you can stay up to date with our progress notes and when we are hosting our meetings.
And then we also have, so we have 3 groups in the healthcare sector. We have the billing and reimbursement. We have Just Walk, or Walk with a Doc, which Katie and I were discussing that this morning, if it was worth continuing that group, since we've got several Walk with a Doc things that are pretty self-sufficient at this point, if we still need to group. And one of our main advocates for Walk with a Doc is here with us now, Stephanie Ellison. I didn't know if Katie, you had any other big announcements for that, or Stephanie, if you had anything you wanted to let the group know. We got a couple new folks on that, I guess one for sure new folk on the team. So yeah, if you guys want to just chat about that, we can do that real quick.
Oh, Stephanie, you're on mute. Oh, and would you also want to introduce yourself, just so our new faces know who you are?
Sure.
The awesome work you do.
Yes. I'm Dr. Stephanie Ellison. I'm a professor of emergency medicine. I still practice at University Health Truman ER, and I'm the associate dean at the School of Medicine of Learning Initiatives. So one of my big jobs is to make sure we have adequate service learning and community engagement across our courses and clerkships within our School of Medicine. And that extends to our other professional programs too. So as part of that, the original Walk with a Doc is now 10 years old. It was started by Betty Dries 3 deans ago. And it was continued by a very active group of students in our wellness program for the medical school. And I can't say partner, we collaborate with the AARP, and that's really led to, I think, some good success. We're about to have our 44th walk in a row with them. And we meet out at the Southeast Community Center. I'm trying to renew that now. I will admit the AARP connection has been a little tough. It was very much about 2 women that helped out. And now that it's gone sort of more national, they aren't really advertising our Walk with the Doc as much as they did. So we have a core group of about 12 women who always show up. And we invite them to bring grandkids, children, visitors, neighbors. And that's gone, I think, fairly well. But we have included it as part of the pediatric clerkship and the family medicine clerkship. And we're creating a Walk with the Doc out at Lakewood. So we're trying to get to, we're a big city with a lot of suburbs. We're trying to get to more. I hope Just Walk doesn't go away though, because I know the students engage in it on the main campus. And then I'm planning on hosting a noon walk on the MKC campus on weeks that Just Walk isn't walking. So I hope they aren't, but I know KCMS has a Walk with the Doc as well. And so they kind of come and go with other medical schools. But I feel that it does meet a great need, and we have a really good group of regular walkers. That engagement from the AARPs, I'm trying to work it out. Where the lawyers are meeting again on what the contract looks like, and I just do what I'm told.
Yeah, and Katie got some information from someone who was on our group last year who wanted to start a Walk with a Doc, but kind of went by the wayside. But maybe he's coming back, and we don't know if our resources that we offered then are unfortunately no longer available because there's a lot less funding than there was. But that might be another spot where some people could go do some walks.
Mm-hmm.
So
yes, yeah, and Angela Barnett is making that part of that funding and program that we had. And the strength will be in the residents. We'll have it as a project to keep it going. And they've finally found a time on Friday at noon, maybe twice a month, but I think are going to start with once a month. So I still think, or maybe it's 11. I still think that will get started here, and their goal is by the end of the summer.
Thank you for continuing that hard work, and hopefully the university will keep backing you up there.
Yeah.
All right, Katie, did you have anything else from Just Walk?
No, but in regards to what Jay was saying earlier with possible interest from another organization, I mean, if that ends up happening, then perhaps we should schedule a smaller subgroup meeting.
Okay.
So I'll probably reach out to you, Stephanie.
Oh, that would be great. Thanks, Katie.
Yeah.
And Jay.
Sounds good. And then the third group that we have is the curriculum group, which we've had some success, I think, over the years, especially over at UMKC, getting more exercises medicine, and really I think it turned into more lifestyle medicine, getting part of the curriculum. And I think there's a beneficial push by the FDA, or actually I don't know who's the Health and Human Services, maybe, that required the 40 hours of med school training for nutrition. They didn't specifically talk about exercise, but I think that's an easy, well, I don't know about easy. I'm not in charge of any curriculum, so maybe I'm making that sound easier than it is. But I think it's a logical addition to nutrition education, is adding exercise as medicine. So as far as I know, it's gone pretty well at UMKC, both in the PA school and the med school. At KU, we haven't had as much feedback, but the last time we heard, 6 or 9 months ago, it was definitely starting to get implemented, and we haven't heard anything about it from KCU for several years. So I don't know how integrating exercise medicine and lifestyle medicine is going over there, but Nicole, maybe you have an update on that.
Happy to comment. Stephanie, or Dr. Ellison, I'm Nicole from Merrick. I'm faculty at KCU, and myself and Dr. Elledge, who's family medicine obesity. I'm FM, ONMM in sports. So we're like part of the nutrition initiative. So we have been working on kind of the curriculum and looking at where our hours are. We do have exercise prescription, a lab as a part of like our osteopathic labs that we do. So we are including that. I'm actually the one who teaches that. So, and then we have a good amount of hours that we already had and have had a lot of ideas. We've kind of been in a holding stage just for trying to figure out who's going to take what roles. I do know a couple of the places that we are really looking to integrate the nutrition in is potentially in our standardized patients in some way, in our Score One for Health. If you're familiar with Score One, I would say most of probably CMH is probably familiar with that program, hopefully. And then also, oh my goodness, it just fell out of my brain. Some of our clerkship type things, we were thinking about having some didactic related to that, like recorded modules. Oh, and the other one was poverty simulation. So we had previously done a poverty simulation. The last one I was involved in prior to graduation for me was 2018, 2019. And so we're looking at that and trying to tie it into the nutritional component in some way, whether it's cost of choosing food versus grocery, all those types of things, time, that kind of stuff. So tying some of those things in. And that would be something that all of our students would go through. So those are some of the places we're looking to tie in the nutrition initiative from the KCU perspective.
Yeah, the MOCAN statistics are Missouri based, and they do include food security in there. So that's a really nice place to do it. And I do remember we stopped right around the time of COVID as well. As in our debriefing, we asked the students to, you always had to get the transportation cards. Like, well, I'll walk. But time is effort. Like, you have 15 minutes for your week. So we'd always kind of say, like, so are you going to run? And are you going to run with your kids to get them to school? So we always try to connect that to them, is that while you're busy and rushing around and under all of this stress, where's the exercise? And that there's not time for it. Yeah. So it is a really good exercise, and it's a simulation where I think there's a lot of deeper learning. So you have both the food as the nutrition element, as well as the physical activity component to stress. It's a great idea.
Yeah,
Yeah.
so we're trying to find ways where, the biggest concern that came out when all of this came out, as many of you know, is the time to students, right? Being a good steward of their time, and
Yes.
trying not to just add 20 hours of curriculum to them all at once. And I think that's the way it kind of got presented out loud. And so we're trying to find ways where we can integrate it without overwhelming it. So one idea we had, and it was very superficial, is looking at, can we do a SP encounter or a group standardized patient encounter? We do that already with like a difficult patient, or with sexual history, we do that as like a group. So it's not as, students can get some of those awkward moments out. And so could we do that with a nutrition and counseling visit, and run something like that for our students? Something that takes the time, fills the hours, but is applicable rather than just here's 20 more hours of curriculum and here's, 50 more test questions. So we're trying to find ways to integrate it, and then also utilize Score One from can we integrate handouts or things being sent home? Because we're already doing acanthosis screenings and blood pressure screenings and all these things. How can we're trying to figure those pieces out, since they are screenings, not physician-patient relationships. So we're trying to decide that. And I see all the comments. I would be happy to connect with you all. I will take that information, and if you want to give me your emails, I'm happy to connect with you all. So
If you'd also like,
Awesome.
I
This
have
is great
everyone's
work.
email. I can send it to you.
oh, that'd be great. Thank you.
Is it in the invite? Might be.
So that's awesome. That's great. That's a wonderful update. We have not had one in a while from KCU. One of the things we were thinking about, Katie and I were talking about, was we had a big success, we think, in the curriculum group several years ago when we brought in Dr. Jennifer Trilk from South Carolina Medical School, came and talked about how they kind of organized their curriculum based on lifestyle medicine in general. And we were thinking, and we were able to get her over to KCU and UMKC and KU Med and Children's Mercy on that whole visit. So she kind of, did multiple talks during that whole visit, which was great. And we were wondering if everybody would want to try something like that again with another kind of nationally recognized speaker. The nice thing about Dr. Trilk is we had a pretty good fund with the KCPA plan back then. We don't really have that anymore, so it would have to be the burden would have to be shared more amongst the four institutions, or three or two, or whatever we decide on. But one of the ideas I had, and you don't have to go with my idea by any means, but I was just at the AMSSM meeting a month ago, and there was a really good speaker, I thought, Brandy Waite from UC Davis, who does sports medicine, lifestyle medicine, exercise as medicine. She's a big advocate for that. And she just talked about kind of, in just 20 minutes, she hit a lot of things, but she talked about physician wellness, and I just think we could, do that. Healthcare worker wellness, how to actually integrate it with the patients and kind of prove to them, hey, you're doing it, or I'm doing it. So this, walking the walk for them, really how she engages with patients on it, with devices and using Epic and dot phrases and tools to make sure she's getting reimbursed for her time that she's spending talking about this kind of stuff. So I just thought it was a real good talk, and I thought maybe it'd be worth seeing if she could come to Kansas City, or someone like her, and give more of a practical, because Dr. Trilk was wonderful. It was more like how to make the school work. With Dr. Waite, it was more like the practical, this is what you do every day in your clinic kind of stuff, and what you do in your life. So I don't know if that's kind of a good next step in the whole process, if everybody thinks that would be helpful, if there's a way to kind of work her in multiple organizations in one trip. I mean, I haven't talked to her at all about this. This is just totally off the cuff, or someone else like her. So it's an idea. I just didn't know if everyone thought that would be something worth, going after.
I think so. Wellness has been a big discussion across the affiliates around us. I'm sure it's at Children's similar as it is at University Health. I know Becky Lowry, who is their chief wellness officer as well. And since we reached out across the schools for curriculum enhancements on lifestyle medicine, it might be helpful, as you said, physician health and wellness has been a big topic, is if that's the approach, if our affiliates would be interested in hosting her, and maybe some of the funding comes from our affiliates, the hospital. This is a thought. Or the med schools is fine too.
Yeah, I think the funding would be probably the hardest part at this point, but
Yeah.
I don't know what the school budget is for stuff like that.
I definitely like the idea of going towards more of an exercises medicine approach, especially given all of the focus and time and energy has been on a lot of nutrition as of late. And like we've already sort of alluded to that, who's to say that, Health and Human Services is going to be happy with including a lot of nutrition into medical school education. The next step might just be exercise or physical activity anyway. In 2 years, who knows? But, getting to exercise or kind of physical activity as medicine, as a theme, but also pairing in wellness, because it can bring in a lot more people who might be more interested in that. And especially since I see the evolution of wellness going more towards an individualized approach and incorporating more facets other than just sort of the typical yoga and mindfulness that seems to be everywhere already, going more towards a, individualized, what do you do for your own wellness? Well, physical activity could be that component, and what variety there is out there. So whoever can kind of speak to that and educate the masses within healthcare, I think would be a great starting point, to a great goal to go to.
Yeah, I think I agree. Someone who can hit more than one spot and on that whole lifestyle medicine and the clinical, functional, practical way of doing it. And someone who's a dynamic speaker that we would all like to hear.
Just to throw it out there, I know it's been a while since KCU, but has been an initiative in this, and I can't speak for our budgets and support from that regard. But it would be interesting too. I love this idea, and I'm just throwing this out there as maybe another speaker idea or something at some point, would be kind of the osteopathic perspective to it. I know it's something we don't have a ton of DOs in the area practicing OMT, or at least that I'm familiar with. But it might be interesting to kind of tie that in as another perspective idea in the future. So I just kind of wanted to throw it out there, whether it's looking at it from that lens of, what's different from a curricular standpoint, or that lifestyle. I've had many patients tell me like, oh, you've kept me off narcotics, right? Because of doing manual medicine. So what does that kind of look like? And that could incorporate things like physical therapists, athletic trainers, OTs, functional med docs, kind of from more almost like you're thinking conference-esque, like it kind of reminds me of the idea of maybe doing something like KU does for sports med. Like one day in the spring, it's like sports med ortho, and they do like a one day with speakers and things like that. So just an idea.
Sorry, trying to hit my unmute button. Yeah, I mean, I think a full day of exercise medicine, lifestyle medicine in Kansas City would be really cool. I don't know. I guess we'd have to see. I think that's a great idea. I guess we just have to see what the likelihood people would sign up for it, and then because that budget's a lot bigger. I know we do a thing every year at Children's Mercy for Young Athlete Conference, and that's a big headache to put forth that whole conference and make sure that the funding all works out. get enough signups and everything. So yeah, great idea though. I really like it.
Yeah, it would be nice to collaborate across our institutions with ACLM certified faculty, obesity medicine certified faculty. I know Luke's has a great women's center, and maybe the keynote speaker is Brandy, you said her name is, and that we invite local experts like Katie, who is ACLM certified and culinary medicine certified, just so we really know who exists across the city and can collaborate, similar to how the schools collaborated. How can our institutions collaborate for the health and well-being of their, oh, good heart, Katie, of the health and well-being of our faculty and staff, and really invite, I think Children's would be a great place too. It would be a nice meeting place to host something like this.
What about pain management too? Might be
Yeah.
Interesting area to include.
Yeah.
And rehab, of course, rehab med. What's the group? Used to be Rehab Institute. Ability Kansas City. KC.
Oh yeah. Ability
Yeah.
Kansas City. It's
Yeah.
it also does children's rehab too. I was thinking
Yeah.
along that same lines, given the meeting we just had earlier this morning. I know Katie and James were there, where they highlighted a something in October geared towards kids with disabilities or those with disabilities, and the physical activity of them as well. I know I'm just kind of thinking outside the box of sort of those those kind of patient populations that kind of, fly under the radar. I'm sure that there would also be physical therapists, exercise physiologists that in the area that might be very interested in taking this opportunity to either, expand professionally on speaking, say they have something going on professionally in the background, that they would be interested in collaborating. I know when I was a docent, I reached out to the physical therapy department at Luke's and got an overwhelmingly response from them on educating students about what a physical therapist actually does. And they were very professional, and especially now that it's a doctoral level education, they can, somebody somewhere probably has something that they're involved with. They just don't know that this group exists or that we're planning anything.
Yeah.
I just threw in the chat too something, again, this is something that I do. So I do a lot of regenerative medicine, PRP, prolotherapy. I've been trained a lot of that in ultrasound. So also I just threw an article in that's kind of interesting from another perspective of like looking at all of these chronic inflammation, poor sleep, lifestyle things we're talking about. There was an article that was recently published about how your outcomes from PRP and the PRP that's produced for platelet-rich plasma is actually better when those things are managed. So, or optimizing that improves the environment for those. So also a totally different, again, kind of like the ability or different perspective, but just something else to put out there too.
Yeah. So if you guys want to kind of pursue maybe a whole conference day, I mean, I'm sure it'll take like a year or something to put together, but I think we could definitely make that our main goal with the curriculum group is try to do that kind of professional education part of it. And I would want to open it up to, and you guys can all weigh in on this, but nursing, pharmacy, physical therapists, PAs, not just a physician thing by any means. But yeah, if we want to go for that, I think that is a great goal and we should start working towards it.
I agree.
Dr. Ellison, I'm just curious, did you say you're a part of the nutrition stuff for UMKC?
Yes.
Do you, just your thought on this, and I'd have to obviously ask our curriculum, and this wouldn't probably be till the next academic year, but do you think that it's something that we could have as a virtual option that our students could attend as a part of like a required day for their nutrition hours? I don't know if that would be an option, but it might be a way for us to utilize the committee to help with those things and those initiatives as well.
So you're talking about the thing we're planning possibly at Children's between all of our affiliates, or what we're doing in our medical school in nutrition?
No, I'm thinking like that one day thing, if it
Yeah.
became a regular thing, could that or portions of it be organized so that 4 hours worth or something students could attend virtually, where we'd have them in the classroom here. I don't know, just an idea to throw out there for us to think about or talk about. You seem like you have more say than I do when it comes to curriculum, probably. So
Well, the interesting part of it is the CME element, the continuing medical education credits. Like Children's has mastered a way to do that. And
Yeah.
so they handle that. They've approached me with IP or interprofessional education and said, how do we do this? I said, I don't know. You guys do it way better than we do it at the med school. So but I do know that caters mostly to faculty and staff with CEUs for nurses and things like that. And we haven't traditionally utilized any faculty development opportunities as education, only because we need to put it in the curriculum and know it's there, not
Yeah.
it's a one
Okay.
off each year kind of thing.
Fair.
So we have not done that. We do give credit to students, however, for their community engaged service learning and helping out with those conferences, knowing that
Okay.
service to the affiliate, service to UMKC is of value, and they can take an elective, but they also get service learning credit across some courses and clerkships. So they keep that sort of civic engagement to the institution. So yeah, I think that would be harder, just because you would need someone managing attendance and engagement and that sort of thing.
Yeah.
Yeah. But an interprofessional education event, that's where we've done that across different, but we can only really get 2 a year. We used to do 14. At
Wow.
the poverty simulation was 5 different times, but it's our groups of learners are like over 550. So
Right.
we've pulled way back, way back. But
Okay. Awesome. Just an idea. Thank you.
Yeah.
If something were approved for CME, would it automatically meet criteria for med student education, or is it a totally
Mhm.
different approval process?
Totally different. And then it has to stick, right? So it needs to be within a course or a clerkship. And
Yeah.
so those are the courses. Clerkships are 4 weeks and 8 weeks, and then the courses are semester based sometimes. So it would, like an entire class of fundamentals of medicine might do that. But then we're asking an entire institution and all these entities to put it on this date. It doesn't work that well in that direction, in my experience with the interprofessional education events.
Could students get credit if they came up with a part of the program or something like that? Would that be a way to, like, if they help plan it or something? Is that anything that would
Just
useful or
service
helpful?
learning credit. So that, like, it's in family medicine now that they contribute up to 4 hours of community engaged learning around the social drivers of health. So just in that aspect, and then that would just be when that family medicine block lands for those 10 students. It wouldn't be for an entire class. So it's much harder because curriculum has to connect back to required courses and clerkships. And then whenever you put objectives in the curriculum, you want them to live there. So that's what we'll be faced with, is Department of Health and Human Services is going to ask us to show where we've got those 40 hours. Yeah. And Nicole said it very well. Dr. Marek said it very well, is you can't just add it on. You have to exchange it, and you have to make it value added. And asynchronous, trust me, they don't love that. They just don't. Like, she's wise in that they're adding standardized patients, but that means you have your standardized patient with small groups 20 times. Like, it suddenly becomes a big beast. And our students would get lost in a large faculty and staff conference where there's CME CEUs for those professionals. But you want it to be placed in a course, and it's there, you evaluate it, you've got ways to know that you've accomplished those objectives. That's kind of the curriculum rule.
From our perspective, if it was something that was going to happen regularly or portion of it, and we made it like you have one of these choices to attend or something, and then you have to submit a summary afterwards of your experience, we could put that in like our clinical medicine, essentials of clinical and osteopathic skills course. you know, where you have to do certain hours or whatever, and that those
Yeah.
then, if they did 4 hours of that, could then potentially count. But it might be something for us to look at on our end, and then if we figure it out, we have to offer. But yours might be a little bit more difficult just because ours is, you know, individual classes. So if we required that of the second years only,
Right.
then that might be an option. So
Right. One example is we do disaster drills every year at UH. We've done 4 this year because of the World Cup. And we have tried to incorporate groups of students even as patients, but now the mass of say 110 in a class was too much. And then even if we tried to run it twice, it wasn't meeting the needs of why it was instituted in our residency for residents all across the building, as well as at University Health as an institution. And it's a citywide deal. We could not find a way to spread out the students to make it valuable and them available at the same time. It's got to go both ways. So.
All right, so it sounds like this would be just simple professional education. Anything past med school is probably what we'd have to focus on. But if students, I mean, so, well, never mind. So good idea. I think we can probably put this on the main agenda for the next curriculum meeting and hash it out more. And maybe get some details and everybody come with kind of an idea to that specific meeting, and maybe we can look at set some dates and goals and things like that to work toward.
Yes.
Cool. All right. So I said I wanted to give everybody time back. We took a little bit longer than I thought. But Katie, anything else more we had on our list?
Oh, I think we covered almost all of it. So I'll say that our next meeting is for just the healthcare sector is Tuesday, August 12th. It will be at our usual time, 11 a.m.
And we also, I mean, Katie, we can also be flexible if 11 a.m. really doesn't work. We tried to kind of get a poll before and didn't get a whole lot of responses. But we can always look at changing that if we think we get more engagement at a different time of day. So just a thought.
Mm-hmm. Absolutely.
Well, I personally got to run because I'm going to the physicals right now. If you guys want to stay on and chat about anything else, we got the meeting open. So I appreciate all of you coming, and I appreciate everybody's input. And really enjoy working with you all. I hope if you have any colleagues who want to join us, please tell them to join. And we want to make this collaborative. We want to try to spread the difficulty of running something like a big conference amongst the group of people who are excited about it. So yeah, if you got anybody else, just let them know.
Great.
Okay.
Bye, guys.
Thanks, everyone.
Katie, can I ask a quick question about
Absolutely.
the funding? Do we have to have it spent by a certain